So I spent 3.5 years as Western Australia's first mental health commissioner, and I was the first mental health commissioner in Australia. So now there's a national commissioner and 3 other commissioners, and it was sort of a bit of a parallel movement to the Canadian Mental Health Commission and also the Mental Health Commission in New Zealand. And so I'd sort of say, like in a broad reform sense, that mental health gets lost in the health system. And so where there's been able to be some broader based focus on mental health specifically and the bringing in of a broader group of people, particularly people with lived experience and community people, then I think that's been a catalyst for reform. So I think the concept of mental health commissions have been a very, very important catalyst. The bit that I've been particularly sort of interested in has been how we've had these 2 separate worlds of mental health over here and the disability system, and when I went to work in mental health, like I just saw people with almost identical needs to the people I'd worked and known with in the disability system. In fact, if you went to some of the less desirable community living sort of alternatives in boarding houses and hostels and all that, then like people were indistinguishable almost. So it did surprise me that when I got to mental health, I brought this very strong belief around self-determination and citizenship and trying to support people one person at a time to build their life in the community. And I read every policy document I could in the Australian context, and there's a lot of work around recovery and nice words around self-determination and all that, but nowhere was there anything which spoke about people having choice and control, which sort of puzzled me, because all of my understandings about recovery is when people become really unwell, they often lose a lot of control about what happens. They may have involuntary hospital treatment and all those sorts of things. So in fact, people have become very, very powerless, and particularly when they've had recurring significant mental illness, they tend not to be able to keep their jobs and all that sort of stuff. So they become very, very disadvantaged citizens. So I think this sort of thinking about taking the recovery lens, which is really about people getting a good life, whether or not they need hospital treatment or medication or those sorts of things, it's still essentially around contributing life, the best life people can have, and the importance of people's family, friends, and important roles in the community. So I then sort of got on a mission with and found that there'd been some very nice work, particularly in the US, around self-directed support, actually for 15 years. So it started off in the Florida Self-Directed Support Program, and I went and saw the program in Texas, and it was working beautifully. People had personal recovery plan, personal budget, linked to their recovery goals, which were then measured. People had their funds on a credit card. There were some restrictions about, split between payment on clinical supports, but quite a lot of freedom around the other supports. And then in the UK, there's been, with the personal budgets in mental health, I then started finding a whole bunch of people that had been working on this. So that sort of and a fellow, Nick Dixon, who I did a symposium with yesterday, they've had 500 people through they call it their Personalisation and Prevention service, but with small personal budgets, and have got outstanding data for people. So with the Mental Health Commission in Western Australia, I then went pretty hard at the concept of I've got 120 people out of hospital with their own personal recovery plans, their personal budgets, their choice of housing. We did a lot of work at the sector. I was very determined because I sort of knew this to be true, that people, could do these things and they would work. So, so we've developed quite a lot of momentum now, and sort of interestingly now with the National Disability Insurance Scheme, of course, there are going to be 60,000 people across the country that are going to be included in the scheme with a long-term psychosocial disability, which is the most amazing opportunity for people. And of course, we've got the challenge of people in that sector have not really ever had the choice before about, they may have had a choice within a program or between programs, but if you didn't fit, often you didn't get anything at all. So people would bounce in and out of programs, whereas our support would be ongoing and to the individual, and of course they could change their support and their providers as they saw fit. So I think a combination of sort of mental health commissions and more, sort of separate focus on mental health from a broader sort of lens. Less people being known by their diagnosis, which is can be what can sort of happen within a health system. So a broader lens around recovery and mental health in a more contemporary sense, and then this concept of more personalised support and more choice and control, I think, is very, very powerful. We've got 1,200 people already in the scheme with a primary psychosocial disability, and the classic stories are people who were stuck in hospital, couldn't get out because there's nowhere to live, people who got out of hospital but are stuck in transitional accommodation. We've had a lot of success getting people into their own homes with a good package of support. Then people can start thinking about reconnecting family, friends, training, employment again. And because when people's lives fall apart and their housing falls apart, very difficult to then sustain these other relationships and things like jobs and all that sort of stuff. So, no, we're very, very driven by this sort of opportunity. I think it'll take time for people. Because everybody's been brought up on this diet of program boundaries and programs, what they can do, what they can't do, and when you start to strip that away, it's a challenge for people to think about what is possible, and it's a challenge for organisations to think about, well, if you took all the barriers away, well, how will they respond? What is their purpose and mission? And so I think those that sort of are well grounded in that are going to do fantastically well.